Today I want to talk a little bit on the uses of medical ozone. First off, we should probably talk about what ozone is. It's a molecule consisting of 3 oxygen atoms that are hooked together, as opposed to the 2 oxygen atoms that are hooked together in the oxygen that we breathe. The 3rd oxygen in the group makes this molecule much more reactive, and when it's introduced into the body, in one of its various forms, is able to induce several reactions that contribute to healing and regeneration. One of the important benefits of ozone therapy is immune benefit. Our immune systems have many different parts that have to function in perfect balance for optimal health. If it's imbalanced in one direction, we will be prone to poor resilience against viruses and illness. People who are imbalanced in this direction are often the ones who get sick all the time. They say that any virus that comes into the house, they're going to catch and they're going to get sick from it. On a more serious note, people who don't have very strong immune function are also more prone to cancer. If the immune system is imbalanced in the other direction and it's always on the attack and revved up, then people are going to be more in a state of chronic inflammation, which can cause a lot of other problems as well. And so one of the struggles that we have in medicine is trying to find that balance between the 2 different components of our immune response. And prescription medications don't generally address these all that well, because you can take one prescription medication that will actually make the other side a little bit worse, or vice versa. And that's why I really love ozone therapy, because it is a treatment that can help to boost the immune system and upregulate the immune system while also downregulating the inflammatory process. A second benefit to ozone therapy is energy production. We all have these little parts in our cell called mitochondria, and if you have ever had the luxury of doing an 8th grade cell biology project where you had to do a cell replica, you probably remember that the mitochondria is known as the powerhouse of the cell. And when we talk about the powerhouse, we're talking about the fact that it is the energy producer for the whole body. Your mitochondria make something called ATP, and that ATP is the energy that fuels every single function in our bodies. So whether it's something as simple as blinking our eyes or formulating a thought, or it's something bigger such as running a race or giving a speech, everything that you do is dependent on this energy, or this ATP. So research is showing that a lot of the chronic and degenerative conditions that we are experiencing, and what we doctors are very frustrated with because they're very hard to handle, but these degenerative conditions are coming down to the fact that our mitochondria are not functioning the way they need to, and we are literally not making the energy that we need to heal and to repair. So decreased mitochondrial function has been associated with autism and cancer and Alzheimer's disease, Parkinson's, kidney and liver failure, and the aging process in general. When a person comes to me complaining of fatigue, I worry that they literally are not making the energy that they need to function. And one of the beauties of the ozone is that it has an ability to affect the mitochondria, and what it does is it essentially turns that mitochondria on so that you can normalize and improve your energy production. Another benefit to ozone therapy that I want to talk about is improvement of blood flow and oxygen delivery to tissues. The delivery of oxygen and nutrients takes place in these teeny little vessels called capillaries, and these vessels are actually so small that our red blood cells have to pass through one at a time, and they also have to do a little bit of squeezing to get through, and they have to deform just a little bit, and when the red blood cells get rigid, they can't get through the capillary as well as they need to, and so they can't actually deliver the oxygen and the nutrients to the cells the way we need to function well. Another thing that happens with blood flow is that the red blood cells can start sticking together, and we call that a rouleau formation. And when they're stuck together, that's another situation in which they're limited in their ability to go through the capillaries one by one and deliver oxygen to the cells. We care about delivery of oxygen to the cells because oxygen is what we need to make energy and make that ATP that we discussed a little bit earlier. Ozone actually changes the electrical charge of red blood cells so that they repel each other just a little bit, and they're more likely to go through the capillaries one at a time. But there's also another cool thing that happens in that they give the membrane of the red blood cell a little bit more flexibility so that they can squeeze through the capillary more effectively. But then also they help one of the chemicals that is necessary for the delivery, the actual unloading of the oxygen, the delivery of the oxygen to the tissues, and ozone helps with that one too. Okay, there are lots of different ways to administer ozone, but after years of experience, I've kind of narrowed my favorites down to just a few. My favorite one is something called major autohemotherapy, and other people know that as MAH, or they call that blood ozone. This is a procedure where we actually draw out some of your blood and we put it into a bag of saline, and then we mix ozone gas in with it, and then we let it basically just drip back into your veins. Sometimes we'll run the blood past an ultraviolet light to help give you a little bit more benefit, but this is not always necessary for it to be effective. The process is fairly fast. It can take anywhere between 25 and 45 minutes depending on how healthy and big your veins are. And this form of ozone treatment is my favorite simply because I think that it's the most effective. I see the best results with my patients on this, and it's the best bang for the buck, and it's a good way to get the ozone administered to the entire system. I usually recommend that my patients start out with a package of 5 to 10 treatments done 1 or 2 times a week, and then once we are able to reevaluate after that package, then we decide on a maintenance regimen thereafter. A second way to get ozone into the system, and this is also one that I really like, and it's something called Prolozone. So this is a procedure that involves a combination of a couple of things. The first thing that we give is a combination of vitamins that are known to help the body just trigger its repair process. So what we do is we inject those vitamins into the area that is hurting or that's degenerated or that's injured, and then we leave the needle in, and then we swap out the syringe, and after we give the vitamins, we literally just follow it up with a little shot of ozone gas, and the combination of those two is really effective for musculoskeletal issues. I use this a lot in muscles, and I use it a lot in joints to help people just kickstart their healing process. And then the last way that I use a lot of ozone is something called insufflation, and that's where we take some ozone gas and we just directly inject it into the part of the body that needs it. We use this a lot for chronic sinus problems. We use it a lot for ear infections. We are able to just take a little syringe and shoot it like straight into the nose or into the ears without the needle, just the syringe, and it can help to increase the immunity and decrease the inflammation in those parts of the body. We can also do vaginal or rectal or bladder insufflation, but we don't do those quite as frequently because generally my patients feel like if they need that, then they would honestly prefer to just do the major autohemotherapy or the systemic ozone.